next session. I request Dr. Sonia ma'am to start the next session.
Thank you, sir. Thank you so much.
Thank you very much.
Thank you, everyone. So let's move on our fifth session, which is on identification of Manasaroga in day-to-day practice. For this session, I like to introduce our session coordinator, Dr. Meena Yadav, working as an assistant professor in Rog Nidan and Vikruti Vigyan department at Sanskriti University, Mathura. And our second day coordinator, Dr. Sahdas Aradhya sir, who is HOD and associate professor in Kriya Shari department at Murlidhar Ayurved College. So I request both session coordinator please take the charge and continue the session.
Thank you so much, Dr. Sonia ma'am. Am I audible to everyone?
Yes, ma'am, you are audible and you can continue the session, ma'am.
Okay. Namaste and welcome to our webinar for this session. I am the assistant professor from Rog Nidan and Vikriti Vigyan department, Sanskriti Ayurved Medical College, Mathura. That due to some personal issues, Dr. Parvati Devi ma'am is not able to attend this session. I am honored to introduce this session on the topic Psychiatry in Journal Practice present by Dr. Suhas Kumar Sethi sir. Good afternoon, sir. Today we will delve in the world of the natural healing and explore the secret of timeless traditions. Our expert speaker, Dr. Suhas Kumar Sethi sir, and chairperson Dr. Prabodh Hiravar sir, we will take you on a journey on this beautiful topic. They will, whether you are a seasoned practitioner or just curious about Ayurveda, this webinar is designed to enlighten and inspire you. So sit comfortably, relaxed, and ready to unlock the treasure of Ayurveda. You can submit your questions in the chat box and we will address them during the question answer session. If anyone, hello, excuse me, is there any, am I audible to everyone?
Yes, Meena ma'am, you
Okay.
continue. You are audible.
Okay, ma'am. You can submit your questions in the chat box and we will address them during the question answer session. Thanks for joining us. Let the wisdom of the ages guide us on this journey. Now it's time for the introduction of our guest speaker and chairperson, sir. For that, it's over to Dr. Ramadas Aradhya, sir. Uh, Aradhya, sir.
Yes, ma'am.
It's over to
Actually,
you, sir, to
yes.
introduce our
So
guest
myself,
for the today's sessions.
myself, Sadas Aradhe. I would like to introduce first chairperson, sir, Dr. Prabodh Yeravar. Now, the introductions are for the chairperson, Dr. Prabodh Yeravar, a highly respected scholar, educator, and of Ayurveda. Dr. Yeravar is currently serving as an assistant professor in the Department of Samhita and Siddhanta at the Faculty of Ayurveda, Uttarakhand Ayurveda University in Dehradun. With a decade of experience in the field, Dr. Yeravar has made significant contributions to Ayurvedic education and literature. He is the accomplished author of 7 insightful books, which includes titles like Sarvanga Sundarokta Ashtanga Hruday Prabodhan, Research Methodology and Medical Statistics, and Shadras Nigam. These works have become valuable resources for students and practitioners alike, reflecting his deep knowledge and commitment to the preservation and advancement of Ayurvedic wisdom. In addition to his academic writing, Dr. Eravar has demonstrated remarkable innovation in Ayurvedic education. He is the creative mind before Ayurtunes, as animated teaching series that brings Ayurvedic concepts to life in an engaging and accessible way. This innovative approach has made learning Ayurveda more enjoyable and effective for students, further establishing Dr. Eravar as forward-thinking educator. So I welcome Prabodh sir as a chairperson of this session. Now, after that, I would like to introduce our today's speaker, Dr. Suhas Kumar Shetty sir. It is my pleasure and great honor to introduce Dr. Suhas Kumar Shetty, who has great contribution towards the field of Ayurveda, mental health, and medical research on both national and international stages. Dr. Suhas Kumar Shetty, MD, Ayurveda PhD, is not only a revered academician but also a respected Ayurveda practitioner, researcher, and administrator with a wealth of experience spanning over 18 years. Currently, Dr. Shetty serves as the principal and medical director at the prestigious ALE Academy of Higher Education and Research, Shri B.M. Kanakwadi Ayurved Mahavidyalaya, Belgaum. His leadership here continues to inspire and shape the next generation of Ayurvedic professionals. Prior to this, he was the professor and head of the Department of Manovignan Evam Manasroga and served as the Dean of Research and Development at Sri Dharmasthal Manjunatheshwara College of Ayurveda and Hospital in Hassan. His impact in these roles has been profound, fostering a deeper understanding of a mental health through the lens of Ayurveda. Dr. Shetty's expertise extends beyond the borders of India as he also of adjacent faculty at the Southern California University of Health Sciences in the United States. His knowledge and insights have made him a sought after speaker at conference and workshops, attracting health seekers and professionals from across the globe, including the USA, England, Scotland, South Africa, and Sri Lanka. Dr. Shetty, sir has authored 3 books and has over 72 scientific articles published in esteemed international peer-reviewed journals. His dedication to advancing knowledge in his field has earned him a place on the editorial and review boards of numerous scientific journals. Among his many accolades, he has received the Continent Grant Award from CCRS New Delhi, the Pratibha Puraskara Award for his social service in treating alcoholic disorders and paralysis, the Bhishak Award 2018 Best Doctor Award, and the Teacher of the Year 2021 Award, to name just a few. Dr. Shetty is not only an expert in mental health care consultation but also a recognized authority in clinical research, research methodology, and medical statistics. His workshop on stress management, particularly in examination and workplace setting, have provided invaluable tools to countless individuals. Moreover, his expertise is frequently sought by national and international organizations, including the World Health Organization, the Central Council of Indian Medicine, and the Central Council for Research in Ayurvedic Sciences, where he serves as a technical expert in policy formulation and consultation meetings. So now I request Suhas sir to start the session and guide us. Thank you.
Thank you very much, Aradhya sir. At the outset, I'm very thankful to the organizers for this wonderful opportunity given to me on this wonderful platform of ATCON, the sixth national conference focusing on the new horizons of Ayurveda. I'm thankful to all the office bearers for these wonderful opportunities. Let me inform all the participants that we are supposed to have my friend and colleague Dr. Parvati Devi, the medical superintendent of the National Institute of the Mental Health Kottakkal, as the speaker. But because of some emergencies, she was not able to join. And just few minutes back, the organizers wanted me to present. I confess that this presentation is by Dr. Parvati Devi, and I'm presenting this presentation on behalf of Dr. Parvati Devi. And if there are any small mistakes, kindly pardon me. But apart from the presentation that is shared by Dr. Parvati, I'll be sharing my clinical experiences in this area where I've been trained and I've been part of this clinical practice for more than 2.5 decades now. As you all know that there is a lot of importance or there's a great public health demand in terms of the mental health issues. People, if you look at the clinical practice, a lot of patients come to you with some mental health issues, and identifying them at an early age or at the early scenario and probably giving them the appropriate care is very, very vital. That is why, if you look at the top areas where we need to focus, especially in terms of the public health, mental health is one of them. Though it is unexplored, not given much of importance, but the days are there. I think, especially after the COVID, people really have realized the importance of the mental health and how the mental health is an important component of the overall health. And the same thing is reflected in Ayurvedic literatures, in the Ayurveda practice, where we see that whether we are talking in terms of the mental health, we're talking about in terms of the types of diseases, the causative factors, the treatment plans, the preventive health care. Everywhere there is a lot of importance for given for both physical and the mental domain. So this particular session is focused on the importance of the mental health in the general practice, because if you look at the general practice, more than 30 to 40% of the patients who are coming to the general practice are some are having some of the other issues with the mental health, either directly as a psychological disorders, or they are prone to suffer with psychological disorders, or there could be some secondary effects as a component of the physical diseases like diabetes, hypertension, cancer, stroke, etc., to name a few. So let's probably begin the session. I'll try to share. As I already mentioned, these are the presentation that was prepared by my friend Dr. Parvati, and I'm presenting this presentation on her behalf. The session that we have is the psychiatric healthcare in general. There has been so much of differences or so much of concern when we talk about mental health. So we talk about positive mental health, we talk about the poor mental health, and Ayurveda also has been given a lot of importance, especially when it comes to the sattva or the mano pariksha. They would classify the mental strength into pravara sattva, madhyama sattva, and avara sattva. The best way of probably identifying the sattva in a clinical practice is to identify the the quantum of the self motivation, whether the individual, suppose you give some scenario or give some circumstances, whether the person is able to match or able to be self motivated for any scenarios, maybe in terms of a positive scenario or a negative scenario. If a person is motivated by seeing others, we consider it to be the second category of moderate sattva. And if it is a person who is not either self motivated, not gets motivated by others, is the avara sattva. Because this classification becomes very, very important as per the diagnosis, as well as in terms of the treatment protocols. Because a person of pravara sattva may require one or two sessions of sattvaja chikitsa, and a person may be able to come out of this problem. Whereas a person of avara sattva needs repeated sessions, longer sessions, and a continuous follow-up of the patient is very, very vital. So identifying this is very, very important. Moreover, in developing country like India, where the mental health is still a very big taboo, patients do not come directly with the mental health issues. As physicians, we need to explore the possibility, and sometimes we have to take some time to do the rapport building with the patients, then probably try to identify their issues. And once we develop a good rapport with the patients, then probably we come to know that there are some psychological issues with the patients, which is a main causative factors for the development of either physical condition or the psychological conditions. And in this presentation, the main focus is how do we identify them when we consider that there is some psychological involvement or there is some behavioral involvement, and how do we address the same in case of a general practice. So if you look at the what is the order of mind, no? Whether the body comes first or the mind comes first. See, though we classify the disease as sharirika vyadhi and manasika vyadhis, there are always has been a close relationship between the body and mind, as it is mentioned in Charaka Sharirasthana. Techa vikaraha paraspar anuvartamanaha kadachit anubadhanti kamadayo churadayascha. Sattvam cha shariram anuvisarpati. That the body and mind will follow each other. So that is why sometimes when there is an issue with the mind, it will affect the body, and the same happens in case of the mind and the bodies. So whenever, and the most important challenge that we have in case of the mind is to define the level of normalcy, because the same thing in case of a given scenario, like in case of place, time, person, the same thing can be normal and same thing can be abnormal. Like for example, if you are in a classroom, or you are in a presentation, and suddenly you have an out of way laughing, it becomes very, very awkward and abnormal. But same thing if you're enjoying a nice time with your friends, and if you talk, it becomes very, very normal. So that's the reason why a lot of social norms, lot of cultural norms, lot of psychosocial norms has to be kept in mind before we say whether it is normal or abnormal. So, if you look at the definition of mental health that is defined by WHO, it says that it's a state of well being in which the individual realizes his or her own abilities. And most important thing is we talk about stress. See, basically, what is stress? The simplest way of defining stress is that there is an increased demand and there is a reduced resources. And the stress management focuses on those two things. Either you can reduce your demand or reduce your need, and the other way is to improve or empower your resources. So ultimately, these are the only two ways that we'll be able to manage our stress. See, stress is never a issue, but how an individual visualizes steps or how we perceive the stress becomes very, very vital. That is why both in Ayurveda as well as in case of modern, the stress is sometimes because there's something called as positive stress, which is called as eustress, is also very, very equally important. But on the other hand, if there is some negative stress, then it can lead to various types of disorders. So, if you look at the references or the literature of Ayurveda and try to find out the references of mental health, you find it everywhere. Whether you're talking about disease, you're talking about health, you're talking about management. Like for example, if you talk about the Swastha Lakshanas, Samadosha Samagnishta Samadhatu Malakriyaha Prasanna Atmendriya Manaha Swasthiti Vidiyete. You're talking about the Trivida Roga Karanas, Asatmendyartha Sanyogaha Prajna Parinamascheti, Dvayanam Apidoshanam, Prakopati with a Karanam. Or if you're talking about the treatment, you're talking about Satvaja Chikitsa, you're talking about Yuktya Chikitsa, you're talking about the Deva Pasha Chikitsa. Prashamyati Aushadam Purvam, Deva Yukti Vipashayehi, Manaso Jnana Vijnanam, Dhairya Smriti Samadhibhi. As mentioned in Charaka Sutrasthana first chapter, he mentions that all three of the modalities of treatment, the Yuktya Devapasha, as well as Sattvaja Chikitsa, are beneficial for the management of both physical disease as well as psychological disorders. So that is why sometimes we have to understand what do you mean by a poor mental health or a mental disorders. See, how do you plan the treatment? See, first of all, people who are mentally healthy, they also need to maintain them because Ayurveda also talks about prasanna atmendriya mana. It is not just normal but also well-being. So we should focus on the well-being, though a person is said to be healthy. We should second set of conditions are those people who are prone for mental health disorders because of the susceptible predisposing factors. Next, we have the minor mental disorders and then we have the major mental disorders. So this category is very, very important for planning the treatment. So let's see what are the signs or the characteristic features of the poor mental health. Those people who do not share feelings. See, nowadays you have a lot of people having suicidal thoughts, suicidal ideations. The main issues is they do not share their emotions. There are young adults, adolescents, elderly people, population of the people who are having a lot of psychological issues end up having suicidal thoughts because they do not share the feelings. They're not able to control their behaviors. They deny the problems. They do not accept the changes. And this is a major problem with our youngsters now. They are very, very prefixed. And whenever they are never flexible sometimes. They are never adaptive. And that is why when they enter a new scenario, maybe once they go to a new job, they get married, or they go for a new country or a new place, they sometimes find difficulties. They go to hostels. They really find difficulties to adapt because we have never taught the life skills how to be social beings. We now have social networks, but we hardly have a social relationship among within the family as well as outside the society. They are very aggressive, they are depressed, or they are closed-minded, or sometimes they do not want to mingle with the patients. So ideally, a mental disorders is a behavioral or a psychological syndrome which causes significant psychological stress. The most important thing is there should be a significant impairment in the functionality of an individual, maybe the personal functionality, social functionality, or the occupational functionalities, and not merely an expected response. Like somebody dies and you are sad, it doesn't come into the category of a disease. But even after 1 year, 2 years, you are depressed, you can put on the category of a disease. If you look at the prevalence of psychiatric disorders in general practice, more than 25% of the people suffer with some psychological disorders. 40 to 50% of the general practice patient who come to the general practitioners will have some or the other psychological, and this is leading to the delayed or incomplete recovery even from the physical illness. Like for example, a patient of diabetes or stroke or cancer, if he doesn't have a positive mindset, his recovery is. See, I still remember treating one of the top police officials. He always used to say, Dr. Shetty, my diabetes is not in my pancreas, it is in my brain. And if I'm stressed in my work, always my diabetes shoots up, which always emphasizes on the close relationship between the body and mind. See, psychiatric diagnosis as well as approach is always different from physical disease because starting from the way patient come to your OPD, suppose a patient has fever or joint pain, he directly will tell that he has joint pain or fever. Because suppose a patient is suffering with OCD or depression or generalized anxiety disorders, he comes sometimes may not tell you the classical symptoms of these psychological ailments. He may start saying that I'm having headache, I do not get good sleep, I do not have good appetite, I have body aches, I have multiple weight complaints, and that is why the psychiatric diagnosis is always different from the physical disease, and it's always very challenging because there are no clear cut laboratory investigations. Hardly we have some physical signs, and there is no external validity. It's very difficult to say what is normal. As I said, normal in one situation could be abnormal in the other one, and there's a lot of social cultural impact which need to be considered. And the most important key for the psychiatric diagnosis is a good rapport with the patients and a good interview with the patients. So when do you explore further that there is some psychological illnesses? When patient complains of unexplained multiple somatic symptoms like headache, body ache, back pain, low back pain, abdominal discomfort, etc. The patient comes multiple visits and patient do not find appropriate changes. The patient, there is no physical symptoms which is appropriate to the clinical presentation. Patient looks very dull, hopeless, irritable, and there is always no a patient is not satisfied. These are the probably the clue that you should explore the psychological involvement. So when do you consider a patient to have a emotional problem? If they report difficulty in managing their day-to-day routines, or they have problem with their sleep, they do not enjoy the things. See, there's something called as anhedonia, like what Ayurveda talks about the icha. Yatram purvamicham asit tatra aniccha bhavati. So all those which patients used to enjoy. I used to enjoy going to movies. I used to enjoy going to a ride. I used to enjoy playing music. I don't like nowadays. It's a very, very typical symptom that patient could be going into the symptoms of depression, one of the major psychiatric disorders involving in alcohol, smoking, etc. Change in their eating habits, sleeping habits is one should really explore the possibility of some emotional disturbances. So if you look at the overview of the major psychiatric classification, earlier, like a decade ago, we used to classify all psychiatric disorders as psychosis and neurosis. We no longer use them in the medical or the psychiatric classification of ICD or DSM nowadays, but this was how it was classified as psychosis and the neurosis. Psychosis, where a person do not have insight, a person do not have proper organization, a person do not have self-awareness. Like ideally, the patient of the Unmada are ideally what they have classified into psychosis, and whereas the Atatva Binivesha, Chittodvega, etc. are the neurosis, where a person still have some overview of the conditions. We also can classify it as severe mental disorders like schizophrenia, bipolar disorders, schizoaffective disorders, delusional disorders, or common mental disorders like anxiety, depression, insomnia, etc. You can also divide the psychiatric disorders or mental illness into organic mental disorders and the functional mental disorders. So, why does an individual develop psychiatric disorders? What is the basic cause? See, we can divide the causes into predisposing factors, precipitating factors, and the perpetuating factors, which further can be classified into the biological symptoms, the symptoms related with the social factors, and the psychological factors. So, there is a beautiful model of mental health called as a psychosocial model, which again talks about the Sharira, Indriya, Sattva, Atma, which is actually because it's a multifactorial disease. We cannot just depend on a particular factors because there is biological factors, there are genetic factors, and also there are so many neurotransmitters, hormones, etc. See, like for example, GABA or dopamine, or it could be various different types of serotonin reuptake inhibitors, which are said to be the cause. And always there's a debate whether the symptom causes the change in the neurotransmitters or neurotransmitters disruption causes the psychological symptoms. So it's like no, the hen and the egg. It's the same scenario which goes up here also. So if you look at what's the relevance of identifying the psychiatric disorders in the primary care settings, early diagnosis and treatment is very, very vital, which we agree in all the conditions. The timely referral to the psychiatric specialist, like especially when they are like a pediatric patients, vulnerable patients, pregnant ladies. Like for example, a patient of pregnant ladies, there can be four categories of pregnant ladies who can be referred to as psychiatric patients, like who develop the psychiatric patients symptoms for the first time, or they have previous history of psychiatric disorders, they get pregnant, or they are having the issues and they get pregnant, or they develop the psychiatric disorders for the first time during the pregnancies. So they all need to be evaluated thoroughly and accordingly the treatment has to be given along with the general line of treatment. The early presentation commonly occurs in the primary care settings. That is why if at all you feel that there are some issues to be addressed, always try to refer to the specialist. So there's a huge need for the mental health care in the general practice settings because most important to reduce the stigma. Still, though we say India is in the Viksit Bharat of 2048, but still the awareness as well as the acceptance of the mental health is very, very poor. Just as the body can have disease, the mind also can have disease. It is okay that we accept that people can have the psychological disorders. Most importantly, to improve the access of the care is very, very important. How? Because there are very less people with specialized in mental health professionals. So the training and empowering them is very, very important. And where Ayurveda can really play major role is in the prevention of mental health in terms of the dietary advices, lifestyle advices, some simple dinacharya practices like Nasya, Abhyanga, Shiro Abhyanga, Pada Abhyanga, etc. can play a very, very major role in maintaining the mental health. Yoga, pranayama, meditation can be a great help to the patients. A better physical accessibility, and most importantly, there is a lot of care that can be given to reduce the financial burden to the patients. So if you look at the symptoms with which patients will come to you, could be mood symptoms like depression, anxiety, fear, etc. Cognitive symptoms like delusions, obsessions, behavioral symptoms like being hostile, suicidal thoughts, perceptual symptoms like hallucinations, delusions, and very oftenly, of course, the somatic symptom like pain and numbness. So how do you arrive at the psychiatric diagnosis? So always you should be very, very careful because we have to do the lot of rapport building with the patient because patient do not speak up or open up very easily. Only when the patient feels that he or she is really taking care of him or her, then only they will come up and they will try to open up. Assess for the psychiatric symptoms, compare the present functions with the developmental stage, especially in the children. whether it is a psychological disorders or a part of the normal development, or there is a psycho developmental issues are present, you always need to analyze. So if a patient screens positively on anxiety or depression, which is majorly seen in the patients, always try to identify what is really bothering them. Like if you look at the symptoms of the patients, it could be the personal problems, or it could be the problem with the society, it could be suicidal ideations. So we can classify them into major psychiatric disorders and the minor psychiatric disorders. The major psychiatric disorders includes mood disorders and schizophrenia. Minor, of course, includes anxiety, depression, obsessive compulsive disorders, insomnia, disorder of the sexual functions. So we can classify the symptoms into physical symptoms and the psychological symptoms, where it could be a biological symptoms in terms of appetite, palpitation, loss of libido, menstrual irregularities, etc. Or in anxiety like dry mouth, palpitation, it could be sleep disturbances, early morning wakefulness, and the psychological symptoms, especially in case of depression, could be low concentration, low mood, very less talk, no interest in life. So there are three classical triads called as hopelessness, helplessness, and worthlessness. We always say that in depression, people always worry about the past. In anxiety, people are more apprehension about the future. If you look at the beautiful description that we find in Ayurveda about understanding the mental health disorders, the one of the most important chapter, maybe in Charaka, Shushruta, Vagbata, or any of the later authors, probably Unmada is the core chapter which deals about the maybe the common signs and symptoms, common etiological factors, the treatment plan, everything like the importance of Shodhana, how do you plan Shamana, everything you find, even the mental status examination, you find very nice in Charaka Nidana as well as in Charaka Chikitsa, and of course from other Bratrayis. We basically classify the Unmada into Doshaja Unmada and Bhuta Unmadas. Doshaja Unmadas, when you're able to identify doshas, set parameters like the doshas, Agni, etc., when you are able to identify the Karyakarana Siddhantas. On the other hand, if you're not able to identify the Karyakarana Siddhanta, you always would like to categorize under Agantraja Unmada or Bhuta Unmadas. So always there's a lot of description about how Bhuta Unmadas develops. Basically, it is because of the personality changes, because of the psychological bereavement, or it could be because of the death of the neones, or it could be because of the avarasattva of an individual, which are the major causes of diagnosis. The most important, the diagnosis on psychological disorders happen through, as I said, more than the laboratory investigations, it is through the history and the mental status examination. We always try to diagnose using appearance and behavior, speech, thought, perception, cognition, etc. So that is why there is a very beautiful description that we find in Charaka Samhita Nidanasthana, 7th chapter, as well as with Chakrapani Tika and the later authors and the scientists from NIMHANS, uh, especially the Dr. M.G. Ramu and his team, were able to develop a very nice mental status examination based on Ayurvedic concepts. Like we have the definition of Unmada as Unmadam Punaha Mano Buddhi Sanya Jnana Smriti Bhakti Shila Cheshta Achara Vibram Vidya. This particular core concept can be used for the mental status examination. Like in Manas, we try to identify the hallucinations, illusions, thought process. In Buddhi, we look for the general appearance and behavior, inappropriate laughter and crying. Sanya Jnana, where we look for orientation to place, time, and person. The Smriti talks about the remote, recent, and the immediate recent memories. Bhakti, as we said, is a desire in terms of food, lifestyle, sexual preferences, entertainment. The Shila refers to habits and temperaments, the leisure time activities, the other habits like smoking, alcohol, etc. The Chesta refers to the normal psychomotor behaviors like facial expression, posture, or a person is having the motor activities. Achara is the personal and the social standards in terms of the cleanliness, daily routine, etc. So these are the parameters which can help us to diagnose through the mental status examination. Now we look at what really works, which treatment really works, no, whether it's a medicine or the psychological treatment or the social support. In fact, all of them are very, very important. Okay, because you always should understand that 80 to 90% of the psychiatric disorders are treatable. It's only very few chronic no, psychotic disorders or genetic disorders which are not treatable. Otherwise, if you have a very good systematic approach, most of the psychiatric disorders, mental disorders are treatable, provided we follow a multidisciplinary approach using physicians, therapists, dietitian, and a proper planning of the medications. So it needs the corrections at the psychic as well as the somatic levels. So that is why there is an appropriate significance of the usage of the Sattvaja Chikitsa, the Iktyopasha Chikitsa as well as Daivyapasha Chikitsa. There are a lot of Iktyopasha Chikitsa that need to be planned even in psychiatric disorders. Always there's a debate why we need medicines or therapies in Ayurveda when you're treating mind. Because as I said, there's something called as the interrelationship between the body and mind. It is always said that tapta jagatariva, like the just as the pot and the ghee are interrelated. Similarly, the body and mind are always interrelated. There is like the Shamana Chikitsa is preferred. Shodhana Chikitsa plays a very, very vital role, especially in case of severe morbid doshas. There's chronic patients of mental disorders. You should always try to go for the Shodhana line of treatment. Maybe Vamana, Virechana, Basti, Nasya, etc. are very, very important. And then probably if you can plan for the Shamana Chikitsa. Like you also need some maintenance therapy to improve the quality of life and to control the reoccurrence. There's something called as Shuddha Chikitsa, which is to prevent the disease, to cure the disease, as well as to prevent the relapse of the conditions. So how the Shodhana works in mental disorders? As you know that there is Sharira Shuddhi or there could be Sattva Shuddhi, Indriya Shuddhi, Kosha Shuddhi. This causes the Manas Shuddhi. And then that is where this purification of the Hridaya, Indriya, Shiras and Kosta occurs, thereby leading to the Manaprasadhana. So if you look at most of the references that we have, like the Shodhana Samyak Lakshanas, Vigata Unmata Lakshanas, Dhatu Samya Lakshanas, Swastha Nirvachana, or Langana Samyak Lakshanas, you always find that there is a clarity in case of Shuddhi of Indriya, Shiras, Hridaya, etc., thereby leading to the Shuddhi in the Manas. So there's a correction at the deeper as well as the subtle level. There is avoidance of recurrence, and really it remodels the mind and body because it needs a empty and the pure space for the body to recover, and that is what is provided by the Shodhana therapies. As we know that Shodhana therapies can be Virechana, Vamana, Basti, Nasya, etc. So even the Purva karmas like Shirodhara, Shiro Abhyanga can be of great help. And even the Snehapana, like you have the Prabhuta Snehapana or Uttama Matra Snehapana are required in the management of psychological disorders. Even Vamana, especially in Kaphaja conditions like severe depression or obsessive compulsive disorders or catatonic type of schizophrenia, we always can go with Vamana. Virechana can also be very, very effective in case of, and is the most practiced Panchakarma in psychiatric disorders. We can use the Snehapana like Kalyanaka Girta, Brahmi Girta, Panchagavya Girta, Ma Paishachika Girta, Apara Kalyanaka, Apara Lashanadi Girta, etc. And based on that, we can always select the Virechana Aushadis. Like if it is Ruksha, like Trivitliha or Trivichurna can be used in Kapha Pitta Lakshanas. Eranda Tela can be used in Vata dominant conditions, etc. Basti, I think it's very, very significant because there's a close relationship between Manas and Vata, and that is why using of various types of Basti, like Shamana Basti, Shodhana Basti, Yapana Basti, especially like Mustad Yapana Basti, Gudichad Yapana Basti, Balad Yapana Basti, they are said to be very, very effective in chronic psychological disorders. there are a lot of sneha bastis which can be used. There are references where we get like kalka can be used like vacha, yestimadu, hingu, rasna, etc. Eranda mula kvata or yestimadu kvata can be used and be effectively be managed. Naso is Shirsa Dwaram, and that is why in psychological disorders, Nasya is said to be very, very beneficial, especially those who are less motivated, those who have loss of interest. In such conditions, either you can go with Pratimashanasya, Mashanasya, Pradhamanasya, no, Churna Pindanasya, etc. can be done. Like you can use the various types of Purana Grita Prayoga can be done or Kalyanka Grita Prayoga can be done, and it is said to be very, very beneficial. Like Shirabala Tela, Avapida Nasya with Hingu Kalka, or Darvaridra, Vilbadi Gutika, Sarshapachurna, etc. Though Laktamoksha is not very commonly practiced, but of course, especially in case of Apasmara, Mada, Murcha, Sannyasa, we can definitely use the Laktamokshana. And I think we depend a lot on the Shamana Aushadhis like Churna, Kalka, Grita, Asava Arishtas, etc. And various Medhya Aushadhis like Shankapushpi, Yashtimadu, Sarpagandha, Jyotishmati, Amalaki, Ashwagandha, etc. said to be very, very beneficial. Various Shamana Aushadhis, especially the Grita preparations, like apart from Purana Grita, very commonly we use Kalyanaka and Mahakalyanaka in Vataja conditions. Like we use the Brahmi Grita, Tiktaka Grita in case of Pittaja conditions. Panchagavya, Mahapaishachika Grita in case of Kafaja conditions. If we categorize this and if we can utilize them on a general practice, you get a lot of very good relief to the patients. Other like Abhyanga or the Shirodhara, especially the Shirodhara, Shiro Abhyanga, Shiro Basti, they are said to be very, very beneficial. And a lot of research has been taken place on the usage or the applications of the Murni Tailas in Manasarogas. See, whenever you talk about psychological disorders and we talk about therapies, people always take the Shirodhara as the prime conditions. And again, there are some clear-cut indications and contraindications for the application of such therapies like for which you can use like the Kshira Dhara, Takra Dhara, Kashaya Dhara, Taila Dharas, etc. based on the doshic involvement. Like they are very effective Shamana Aushadhis like Manasamitravati, Gorochana Vilvadi Gutika, etc. But based on the practical experiences, I always feel that more than the Shamana Aushadhis, the Sattvaja Chikitsa plays a major role in most of the minor to moderate types of psychological disorders. There are various types of treatment modalities or the techniques or the tools which are available as mentioned in Charaka Sutra like Jnana, Vijnana, Dhairya, Smriti, Samadhi. Bihi. And how does it work? Basically, it will correct the manovishyas like Chintya, Vicharya, Uhya, Deha, Sankalpa, and the all these manovishyas gets cleared and it regulates the thought process, clears the ideas, and helps an individual to take the appropriate decisions. Apart from this, I think especially if you look at the hospital like the Kottakkal Ayurveda Mental Hospital, which is one of its kind in the country, which offers the mental health care at the government level. I think this is one and only one exclusive where Dr. Parvati is the superintendent and their hospital is providing very authentic Ayurvedic practice. And there are other institutions which also provide good mental health care. And like there are post-graduation institutes like SDM Hassan, we have in Udupi, BHU, Mudbidre, etc., where they have post-graduation in Manasaroga and they are providing a very authentic classical way of treating various psychological disorders to mention few of the therapies which are commonly used, like the Shiropichu or Shirotalam is said to be very, very beneficial. This is one such conditions. Shirolepa also where we can use like Kachura Dilepa or We have Trifaladi Lepa, or we can use the Sashrapadi Lepa can be used. The Dhara, again, based on what the conditions, we can use Taila Dhara like Kshirabala Taila, Tungadrumadi Taila, Brahmi Taila, etc. In Pitaja conditions like Chandanadi Kshira or Ushira or Yashtimatu, etc. In case of Kafaja, like we have Chakradhara, or we can use Jatamayadi Kashaya, etc. Dhumapana also said to be very, very beneficial in patients who lack motivations, who are having a lot of hallucinations, delusions. We can use the Dhumapana like Shirisha the Dhuma, or we can use different types of Anjana also can be used in such conditions. So again, these are the different types of Anjana which are used, like Shirotalam. So always try to understand the as a at a general practitioners, or if you're at a primary healthcare setup, try to identify the conditions where you need to refer the patients to the specialists, especially those who are specialized in Manasoga or who have been trained in mental health care conditions. Like we have the serious risk of suicidal thoughts. Never ever neglect those patients who have some suicidal thoughts. Always observe their behavior, observe, do not make them to stay alone. Those who are severe risk of harm to the others, who have significant self-neglect, especially those who have severe depression, severe psychotic disorders, schizophrenia, etc., and those who do not have proper social support are said to be at tremendous risk. So there's one more category of patients called as treatment-resistant depression, where again they need to have specialist care by the person, or those who are having comorbidities, like with diabetes, they have depression, with hypertension, they have anxiety. With cancer, they have post-stroke depression. So these are people who really would need a referral to the therapist, and they can be taken good care. So at the same time, I would like to request all my fellow colleagues to take care of yourself also, because your mental health is also very, very important. I think you all might have come across that the highest number of suicides are conducted, done by the doctors sometimes. Even and among them, the psychiatrists are said to be one of the most common people who undergo a lot of emotional turmoils. So that is why take care of your health, take care of your psychological well-being, involve in good healthy dietary practices, involve yourself in yoga practices, meditation as per your need and as per your preferences, because if you do not take care of yourself, you'll not be take care of the patients. So my teacher always used to say that, no, heal yourself to heal others. Take care of yourself so that you can take care of other people in the future. So, to conclude, Ayurveda elaborately describes the etopathogenesis and the management of Manasaroga. The treatment should focus on the specific causes of the disorders and the removal of the etiological factors. And the most important thing is the alpa sattva or avara sattva is considered the essential factor for the genesis of Manasaroga. So that is why increasing the sattva guna can definitely help for the prevention of occurrence of Manasaroga. Like a very healthy sattvic diet can help to prevent the Manasarogas. And most importantly is to promote the sattva bala. Attain the hita, ahita, viveka is very, very important, and dhi dhairya atmadi vijnanam manodosha aushadam param, and incorporating yoga, meditation, pranayama, etc. in our daily routine is very, very vital. So I would like to conclude with this quote from Charaka Samhita as well as from Astanga Hridaya. Nityam hita ahara vihara sevi samikshakari visheshu asaktaha dataha samaha satyaparaha kshamavan aptopasevi cha bhavantyaroga. One who is indulging himself or herself in the regular or constant practice of dietary lifestyle habits, they are away from their external worlds or being detached, involving in the charity, truthfulness, sacrifice, and being forgive is very, very vital for preventing various types of disorders, especially the psychological disorders. So once again, I would like to thank the Ayurveda Teachers Association led by Dr. Suryavamshi and his team and the entire people who have been taking so much of care in organizing this sixth national conference, AtCon 2024, where the focus theme is on the newer horizons of Ayurveda. As I said, uh, this was a presentation to be done by Dr. Parvati Devi. So I would like to just present this on her behalf. And again, this is really a great opportunity for me to share my experience. Thank you.
Dr. Meena
No,
ma'am, Dr. Sarada Saradya sir. Yes.
Meena madam?
Yes, ma'am.
Okay. Uh, I request Prabodh sir to have some words about the speaker. Hello, Prabodh sir,
Am I audible?
are you there?
Yes,
Yes,
yes.
yes,
Am I
yes.
audible? Yeah, okay. First of all, I congratulate Dr. Suhas Kumar Shetty sir for a very pinpointed and valuable presentation on mental health. In his very first slide, he has discussed about relationship between Manas Rog and Sharir Rog. में एक केस जो जब मैं यंग था अपने टीचर्स के पास पढ़ने जाता था तब की एक केस मैं डिस्कस करना चाहता हूँ बहुत पिन पॉइंटेड है मानस रोग को लेकर there was a young girl around 18 years with a complaint of suicidal tendencies. Whenever she used to come from her hometown, which was in J&K, she felt like jumping from the train. Actually, वो एक BUMS की स्टूडेंट थी और जब भी ट्रेन से आती थी उसे लगता था कि मैं ट्रेन से जंप कर जाऊं तो हमारे सर ने उसे काफी दिनों तक ऑब्जर्व किया उसकी हिस्ट्री ली और उसे देखा कि उसे बार बार फीवर होता था और जब भी फीवर होता था वो कोई एंटीपायरेटिक पैरासिटामोल खा लेती थी और ठीक हो जाती थी ऐसा ही वो कई महीनों तक चला और अल्टीमेटली शारीरिक रोग मानस रोग में कन्वर्ट हो गया और उसे सुसाइडल टेंडेंसीज और जैसी कुछ मानसिक लक्षण दिखाई देने लगे तो ऐसे कंडीशन में केवल और केवल शारीरिक ज्वर जो पुनरावर्तक ज्वर हम कह सकते हैं उसे उसकी ट्रीटमेंट उसे दी गई और बहुत स्पेसिफिकली 5 ड्रग्स किरात तिक्तम तिक्ता मुफ्ता परपटको अमृता ये 5 चीजें उसे दी और विद इन अ मंथ उसमें बहुत इंप्रूवमेंट दिखाई दिया उसके ये जो सिम्टम्स थे मानसिक लक्षण थे वो कम हुए तो जैसा कि सर ने कहा शारीरिक और मानसिक रोग एक दूसरे से कनेक्टेड है और जिस तरह से इस सेशन का टॉपिक था आइडेंटिफिकेशन ऑफ मानस रोग पेशेंट इन डे टू डे प्रैक्टिस तो आइडेंटिफिकेशन इज इम्पोर्टेंट वेदर द मानसिक लक्षण आर रिलेटेड टू शारीरिक लक्षण और नॉट so lastly I congratulate the organizer for organizing this resourceful conference and giving us a full menu of different topics in one plate thank you
Thank you so much, Prabodh Hiravar sir. Before giving the vote of thanks, I want to discuss one thing. As early sir told that we are living Viksit Bharat, but if we see in our society and in our family also, the mental issues are taken as a means ki if you discuss your problem with your loved ones also, they will also thought ki no, you don't have to go to doctor. Means people thought that you will become pagal or something like that. They are commenting. So today's session is really very incredible and knowledgeful for us. So thank you so much to Parvati ma'am also because she is not present here, but the essence of her in her PPT it affect us like she is there with us. And explanation given by the once again, thank you so much, Suhas sir. Now it's time to give my vote of all of you for being an integral part of our webinar, which is 6th National Conference at ACON, a New Horizon in Ayurveda. Being the coordinator of this session, the vote of thanks on this memorable occasion, I would like to extend my heartfelt gratitude to our for sharing their valuable insights and Prabodhi Arora sir, because the example he gave to us is really helpful for in our clinical practices also. I would like to thank Dr. Parvati Devi ma'am also, uh, because this PPT reflected all the things which is needed in Manasik Vyadhi and in our clinical practices that will be very useful for us. I would like to thank our chairperson, Dr. Pramod Yaravar sir, from their busy schedule, because due to some personal reasons, he is also not available in the morning. But because of his effort, he will make some time to give us the opportunity to listen him. Thank you once again to everyone. Our attendees also thanks for your active participations. Thank you all once again, and we will look forward to our next webinar together in future also. So thanks a lot everyone, and it seems there is no any confusion or no any question in our chat box. So we will conclude here, and thank you so much everyone. Thank you so much.
Thank you so much, Dr. Suhas Shetty sir, for accepting our last moment request to conduct the sessions on behalf of Dr. Parvati Devi ma'am. We are privileged to have you on our panel. Your deepest knowledge and passion for Ayurveda have provided us with a valuable perspective and greatly enriched our understandings on Manasaroga, that is mental disorders. And we are truly inspired by your words. Thank you so much, Dr. Suhas Shetty sir. Now, I'd like to thank Dr. Meena Yadav ma'am and Dr. Sarada Saradhe sir for nicely conducting the sessions.